to join us. Sally Denley's been we've known each other over a little while, but particularly around sort of work on mental health within the public health department, in getting, talked initially about the JSNA and about suicide prevention. And there's been a lot of anti-stigma work with Sally, and Paul Lucy, who's coming later, our public mental health champion, will be talking about. Thank you, Sam.
Okay, thank you very much, David. I just want to thank you, Sam, on always called Rob by mistake, but Sam, particularly for saying about it's not what defines you, because I'm really, that's something that, whether you've been a victim of domestic violence, or you suffer from a mental health condition, or you're a single parent, or you're a looked after child, I think we all get fed up of being defined by that.
Yes.
And, you know, I look at Sam there, and I know he plays football, I know he runs very well, he can't run, I know he dances, you know, and I think... and we are all so much more. We're parents, sisters, mothers, you know, we may have a mental health problem, and quite a few of us in the room will have, but that isn't what it might, probably actually goes towards what we are, and it probably gives us more empathy, but it doesn't define us. Anyway, off my soapbox now. Mentally Healthy Southampton. I moved down to Southampton. I moved back to Southampton actually about 4 or 5 years ago, and I got a job with the Primary Care Trust as public health manager, leading on mental health and suicide prevention. And at that time, there wasn't really a lot around on the public health approach to mental health. So, yeah. Okay, being a good public health person, first thing I did was get together with our analysts and wrote the Joint Strategic Needs Assessment to see what the needs of the city were. And this we're actually refreshing at the moment, although if Public Health England are doing it for us, I don't know if we need to. But we do have good analysts where we work. So this was the picture when I moved down here. We do have a higher levels of people living with severe and enduring mental health. We are an outlier in terms of suicides, roughly 20 people a year. Over 3/4 of those are men, and the majority are working and are not going to services. And again, I wanted to see if there was something about the city and the prevalence, and see if we could link this somehow to deprivation. So we did this mapping. I don't know whether you can see it, but basically the dark blue areas are the most deprived areas in the city. And the big red dots are where you've got the highest prevalence of SMI. So you'll see the city centre be this area there, that's St Mary's. And then we have places like where the large council estates are on the outskirts of the city, Swaithling, Bitton, Coxford. So there is definitely a link there. And again, that helps them with planning services. Okay, so from the Joint Strategic Needs Assessment, I got together with very many people, including service providers, but mainly people with lived experience in the city, and try and come together with some sort of 3-year strategy, look at the things that are really important to them, but also I wanted to get away from the mental health, the strategy that has people with head in hands. Head clasping, I think it's called, not sure. So this we thought was representative of Southampton. Again, you know, you're not defined because you've got your head in your hands. It can happen to anyone. So it was linked to the national strategy. So mental health is everyone's business. It's absolutely fundamental to who we are. It's a life course approach. Challenges stigma and discrimination, citywide approach, and outcome focused. I wanted in 3 years' time, or actually over the 3 years, for people to actually come up to me and say, you said you'd do this, you haven't done that, why not? Or you've done that, you've done it very well. So these were the pledges. I've got a few copies of the strategy if people want them. I think most people in Southampton are aware of it. It's been around for 3 years now. So some of them were quite we managed to actually get through quite quickly. So the ones around dual diagnosis, there was lots of training that went on, so that one was completed. The two that we weren't doing so well on were the Pledge 2, which is around stigma and discrimination, and the Pledge regarding suicide, which is Pledge 5. There wasn't an awful lot of work going on at the time, so they're the two that I decided to concentrate on. And just looking really at one of the pledges, and this is the one around stigma and discrimination, the priorities were to develop and deliver an anti-stigma work stream. There didn't appear to be one in the city. Time to Change had done some work a number of years back with football, but there wasn't any active joining up of people. So the first thing really was to set up a citywide anti-stigma working group. I couldn't do it on my own. So we got together, we had many, many organisations and experts by experience joining us. I mean, David's here from Southampton Health, Claire's here from the IAP service, got SBS involved, lots and lots of different people, Mind, we've got GPs involved, 2 universities, so a number of people. And the idea was that we'd actually have a big hit, have something very visible, to try and get that message across. Now the first one I did was the elephant in the room. I found this elephant in Southampton University. It was in a cupboard. And I always remember, it was David and Angela from Time to Change. I was like, I've got to get that elephant out of the cupboard. I've got to get that elephant out of the cupboard. So it's one thing I did. Angela looked at me, she said, "You've been a bit psychotic." I said, "No, there really is an elephant in the cupboard." Anyway, that elephant, and he's big.
He's gorgeous.
It's about this big, wasn't he?
Yeah.
And I got him from Southampton University to the Civic Centre, and he's there in the Civic Centre reception. And it was probably the hardest job I've ever done, because our health and safety people at the Civic were just a nightmare. What happens if a child falls off it? What happens if someone tries to feed it? What happens if it's kidnapped? And to make it worse, our comms boys actually took it for a walk out to the fountain and then texted me to say, "You owe 2 buns and a cup of tea and keep relevant." But anyway, the whole idea about the elephant in the room was to get people in the Civic Centre. We've got something like 4,000 staff. So what on earth is that elephant doing in reception? And then we built up the momentum of getting the messages out to people. Well, the elephant in the room represents, that was not really talking very well. And we linked it to national campaigns. And he was safe, and he went home to university. The next thing that was really important for me, and I think both Public Health England and Mental Health Foundation recognise this, is mental health champions. Now, in the centre there is a chap called Councillor Paul Lucy. He'll be with us this afternoon, and he is my mental health champion. He's a politician, and he became my champion about 2 years ago. He's been absolutely fantastic, so supportive, really, really champions the cause, works with Health Watch, taking things through council, and that's Councillor Hannah Coombs, who also joins us, and that guy there is Councillor Dave Shields, who's the chair of our Health and Wellbeing Board, and that's on a Saturday, so that's how committed they are. That's when we ran for Parkman, Time to Change. And I would say to anybody in any locality, if you haven't got yourself a mental health champion, get one. They are fantastic. Really good value for money. Senior level buy-in. Who can tell me who that man is? Anybody? Yeah? Andrew Mortimer. My lovely public health director who's since left us, and his dog. And again, you know, you have to get the people at the top. It's no good me whinging on about how bad things are. You need that level. And again, when I joined the local authority, I trained every single directorate, all their senior management teams in mental health awareness. so that we do have something there. Right, next thing. After we've been working a little while with our anti-stigma working group, we decided we wanted to do something quite big and something that would catch attention. So I started talking to Time to Change, the national organisation, because we knew that people actually recognise the branding. So we thought, well, why don't we just join with them? So in fact, they came down and we had our first Time to Change event in October last year, as part of World Mental Health Day. And we had the village down, we had providers there. And it worked quite well. The only thing was a really cold day. And we had 3 pros. And we didn't quite get the number of people there, but you know, you live and learn. The other thing that I've done is I've engaged with our local park run. We have a big park run in Southampton. There's about 900, 1,000 people run every Saturday. And again, when I first contacted the National Park Run, they said, look, we don't, you know, sorry, but we don't really want to partner up with anyone because we want to keep our brand as Park Run. Well, fair enough. But then I managed to contact the local director, a guy called John Grant, and he really, really got it, both in terms of, you know, people actually being physically active, improving their mental health, and also about the fact that we need to, you know, start addressing this anti-stigma thing and getting people to talk. So a group of people ran last October. And this is one client now. Sorry if I haven't mentioned you, everybody else that ran for me, bless you. All in Time to Change t-shirts, and that was great. And I heard this weekend that because of the work we've been doing with Park Run, that several of the local running clubs are actually going to go on training to become mental health ambassadors. And it's interesting because while I've been talking to people at the park run, I'm not a runner myself, but I often think, oh, I don't know, they would all be in Lycra and all be very posh and lots of money and and actually no, it's lovely. You've got guys with their buggies, although they're so competitive. I mean, these poor children. Then you have people like my director with his dog. And you have people, you know, everyone's there. It doesn't matter what you wear, it doesn't matter how fast you run. And a number of people have said that I actually come as much for the social side as the running. And students particularly, they move down to the city, don't know anyone. It's a real community. It's fabulous. Still don't know. Okay, and this was our final event, which happened this Sunday. So we had the park run on the Saturday. And on the Sunday, we joined with Skyride, which is a local event held every year. And we had 11,000 people actually registered to ride their bikes. Could have been more people didn't register. We had a major press campaign, I have to say. They put in, I think it was what we said actually. Actually wrote in the echo exactly what we said, which is quite unusual. We had a massive Time to Change poster campaign. We had posters about this side through the city with Time to Change branding across. Over 15 local organisations took part, experts by experience were there. And we also had, because of the work that I've done, and because of the suicide, and also the information I get from providers, we know that men, don't engage so well. So we actually had a little men's corner where we had Southampton Football Club came along with their blow-up goal and their mascots having the same, a few footballers. And next to that we had the Outsiders, which is a men's organisation that did some research for us, trying to engage men. I really don't know how many people we spoke to because that's still being looked at the moment, but from what I heard, one of the questions we asked was, in the past 5 years, do you think that mental health stigma is reducing in the city? And certainly from what people said to me, and other people I've spoken to, they said yes, the message is starting to get the message out there. More work to do, but the message is getting out there. We had Southampton Ukulele Band Jam, I have to give them a mention, they were fab. Okay, and that's me.